Moving on to today's COVID update, we again have a grim picture to share and a potentially long effort ahead to get the virus under control in this state. I know there's a lot of focus on other current events right now, but I do want to remind everyone that Illinois and the nation, especially the states making news right now for their role in the presidential election, are in the middle of a public health crisis. And we cannot forget to take the necessary precautions to beat this pandemic down. At the beginning of last month, we were averaging 23 deaths in Illinois to COVID-19 each day on average. That average is now up to 45. The number of Illinoisans in the hospital with COVID-19 has more than doubled in the last month, from an average of about 1,500 to now an average of about 3,300. And compared to just last week, every single one of our 11 regions has seen an increase in the average number of people going into the hospital every day with COVID-19. Also, compared to last week, all 11 regions are seeing severe increases in their positivity rates, ranging from a low of 10.0% in regions 5 and 6, and a high of 15.7% in Region 1, northwestern Illinois. The virus is spreading, and every region of the state is suffering from its insidious, invisible contagion. Make no mistake, this pandemic isn't over, not by a long shot. And it's not enough for us to just know more. We have to act differently. Mitigations that limit public interactions only work if everyone takes some personal responsibility for masking, social distancing, and following the CDC and IDPH guidelines. So please do your part and do what it takes to keep yourself and your families safe. I know that we can find a way through this. Time and again, even when the people of Illinois are set back on our heels, we find a way to move forward. And I'm confident that we, working together, will be able to do that. We will potentially eradicate this virus and return to a normal way of life and help our neighbors who are struggling, but we all must work together to get that done. The same can be said for our state's fiscal situation. For decades before I became governor, Illinois' expenditures never matched its revenues. One of the reasons that I ran for office was to finally tackle our fiscal problems in a responsible way while investing in what makes this state a great place to live, improving our schools, expanding affordable health care, creating a durable social safety net, and making our state run more efficiently, all while living responsibly within our fiscal means. Today, this problem has reached a peak as we in Illinois are racking up more bills than we have in revenues. It's unsustainable. My predecessor, Governor Rauner, tried to drag the state underwater with painful and draconian cuts that in the end were blocked by both Republicans and Democrats. His approach devastated higher education, child care, human services, and hollowed out state agencies like those that manage public health and unemployment benefits, all while adding billions of dollars of debt onto our bill backlog. 2 years without a state budget, longer than any other state in United States history, nearly destroyed the lives of the most vulnerable children and families in Illinois. And it left all of us with an untenable situation. The state's inability to fund education also drove up property taxes that are, frankly, already too high. Illinois has had the lowest percentage of state funding for education in the nation, increasing the gaps between schools in low-wealth, high-poverty areas and those with abundant resources. And local school districts raised property taxes to make up for the state's failures. When I came into the governorship, I found a backlog of almost $8 billion in unpaid bills. And working with the comptroller, we brought that down by $1 billion in just 12 months. The state had been paying late payment penalties that reached $950 million per year when I became governor. We went to work and we reduced the late payment penalties by about $850 million per year. The point is, we've been reducing waste and inefficiency from day one because of the problem of the state's finances and the fact that those need to be addressed from every angle. And in my first major address as governor nearly 2 years ago, I laid out our 3 paths forward with regard to the budget. Option 1, immediately make billions of dollars in cuts. Let me offer some context to that. Already, the state of Illinois invests, on average, less money per capita than the majority of states. That's not to suggest that we can't find significant cost reductions. We've been doing that. But if you think cutting government alone is the solution, remember this. If you set aside federally protected programs, court-ordered obligations, and our bond and pension debt, we would have to reduce discretionary spending in our state by approximately 15%. That's 15% fewer state troopers. That's 15% fewer students going to college, 15% fewer working parents receiving child care assistance, and 15% less money for your local public schools, which likely means that your property taxes will increase. You could call this the Republican approach. Option 2, raise revenue within our current regressive flat tax system and impose a higher flat tax, which falls disproportionately on the working poor and the middle class. Option 3 was the fair tax, an option that people have talked about in Illinois for decades because few other states use the antiquated flat tax system. And while the fair tax would have helped to address our budget crisis with the least damage to the working families of Illinois, the millionaires and billionaires opposed it to protect their own wallets, deceiving the public about its purpose, and they ended up prevailing. Sometimes politics works against the best solutions. Had the fair tax passed, we would have been on a course toward long-term stabilization of our state's finances, balancing the budget, eliminating the backlog, making our pension payments, and investing in a rainy day fund in a way that would start to unburden the working families of our state. But the opponents of the fair tax lied about what would happen if it passed, and they left all of the working people of Illinois holding the bag. It's no surprise these are the same people who pushed for Bruce Rauner's agenda and will resurrect his failed crusade any way they can. So let me just say to the people of Illinois, you deserved a fairer tax system, and you still do. But that didn't happen. Republicans swore their allegiance to the wealthiest interests in the state, and they threw middle-class families under the bus. So here we are. I have not given up the battle to balance our budget and to put the state on firm fiscal footing. I will work every day to repair the fiscal instability that has been ailing Illinois for more than 3 decades. I will work with the legislature to implement structural solutions to our decades-long budget woes. But I will never forget that some of the wealthiest and most powerful interests in Illinois did everything in their power to put the burden of this on workers and their families instead of shouldering some of the burden themselves. Because this is this is where we are now. Illinois' fiscal problems haven't gone away. We now sit at a crossroads. Our state finances still require fundamental structural change. In the coming days, I'll be talking with the leaders in the General Assembly about our path forward, but here's what we know for sure. I promised to be a governor who balances the budget and pays the bills that my predecessor left behind. I promised to make sure that our kids get a good education, that we invest in job creation, and that we build a better future for Illinois. There will be cuts, and they will be painful. And the worst thing is, the same billionaires who lied to you about the fair tax are more than happy to hurt our public schools, shake the foundations of our cities, and diminish our state. maybe because they think it won't hurt them. If they cared about giving your child the best public education available, if they wanted you to be able to afford childcare too, if they wanted your elderly parents to be cared for properly, just like their parents are, they wouldn't have fought so hard to avoid paying just a little bit more. People often say that I'm too positive and too optimistic. My optimism comes from the people of this great state and from all of the things that they've endured together over this year. And my optimism has not been shaken. We will get through this. We will get through all of this together. And when you feel yourself losing a bit of hope, I'm always here to offer you some of mine, because I know that the strong character of this state and its people is paramount. And for 2 centuries, it's something that we've always been able to count on through thick and thin. And with that, I'd like to turn it over to Dr. Ezike.
Good afternoon, everyone. So I am proud to have been able to participate in our democracy, and I'm so proud that so many people did as well. While votes are still being tallied, let's be clear, whomever is elected or re-elected president does not absolve any one of us from taking personal responsibility to curb the transmission of COVID-19. Again, regardless of the occupants of 600 Pennsylvania Ave, our role is unchanged. So please, let's do our part, and let's encourage one another to do the right thing. Recently, I started rolling down my window at red lights, and I talk to people on the streets who are wearing their masks, and I say, thank you for wearing your mask. It's a really simple measure, but I feel like it's powerful in that it acknowledges the good acts of citizens, which hopefully encourages them to keep it going. I've only gotten smiles and positive responses in the few days that I've been doing this, but I'm asking you to try this with me. It costs absolutely nothing, but it gives a much needed opportunity to positively connect with our neighbors. I'd also like to encourage people who participated in recent campaign rallies, worked in polling places, stood in line to vote where maybe they couldn't maintain the 6 foot of distance, anyone who participated in recent protests or any other recent events, please get tested. Wait approximately 1 week after the high-risk exposure, because it takes several days after exposure for a test to be positive if in fact you've contracted the virus. But if at that 7-day mark the test is negative, remember that it can take up to 14 days to have a positive test. There are 11 state community-based testing sites across Illinois, and our mobile testing teams are dispatched each week to additional locations around the state. Anyone can be tested at these sites. You don't need to have symptoms, you don't have to have insurance, and you don't need an appointment. So if you think you have been exposed to COVID-19, please get tested and quarantine so that you don't spread the virus to others. The virus is spreading rapidly. We are fully into the second wave or second surge, and the cases are increasing exponentially. Today, we are reporting 7,538 new cases for a total of 437,556 cases in Illinois. And that includes 55 additional deaths for a total of 9,933 total lives lost. And among that count includes a 30-year-old. Overnight, 3,761 individuals were reported to be in the hospital with COVID-19, and of those, 776 patients were in the ICU. 327 patients were on ventilators. Our testing numbers continue to be good, with more than 71,000 tests reported since yesterday, for a total of more than 8 million tests in the state. Again, if you have been exposed or think you could have been exposed, please get tested. You can find a listing of our testing sites on the IDPH website by going to dph.illinois.gov. And please help stop the spread of the virus. Wear your mask, wash your hands, and watch your distance. Thank you.